It's time now for our Weekend Health Roundup, and we've got plenty of new studies to talk about. Joining me now to make sense of it all is Dr. Jessica Shepard, Chief Medical Officer at HERS. Dr. Shepard, always great to have you. First, I want to talk about the health story that just keeps on developing. Sadly, it's the measles, right? The CDC data shows that we're on track to break almost a 30-year record for measles virus infection. So what should people know, and how can they protect themselves?
I think it's important to start first with what measles is and the fact that it is so infectious as a virus in general. And so, like you said, we haven't really seen this type of outbreak for almost 20 years. And a lot of them are obviously going to be in places where there is no vaccination. So I think usually the conversation when people are talking about measles is what is it? It's highly, highly, highly contagious, but it also has outcomes which can be detrimental, especially to children, which can be pneumonia, can be encephalitis, which is when the brain swells. So, one, highly infectious. Now, when we talk about vaccination, that's usually where we get caught up in the conundrum and the conversation and chaos is the vaccine. Now, what we do know is from the time that we've had the vaccine is that's where we really do see that significant decline in spread of this disease. And so that's why there is a vaccine. And we've had an extremely a lot of data that shows that the vaccine is really where we need to be. So it's not so much when people get confused as should I get the vaccine? Yes, it is highly, highly helpful when we want to decrease that, but people need to understand the disease. So I think that that's important to understand the disease and how the outbreak has been so significant over the last few months.
Dr. Shepard, this comes as Health and Human Services Secretary Robert F. Kennedy dismissed all 17 members of a key CDC panel and appointing 8 new members. This change has some pediatricians worried. Why?
I think, when we think of that specific council, that is based on data. They do not have any ties to pharma. These are people who go through studies and come up with the vaccination protocol. Now, I think pediatricians, rightly so, are confused because there was elimination of the entire council. But when we think of a public health issue and disseminating information based on evidence-based data, this is where we get it from. And so we do need a council that's going to institute the correct information, and pediatricians really rely on that. So, going back to what they have to do every day in their office and disseminating that information to every person who walks into their office, this is why we do need councils, and it's very important that we pick right councils, and we're going to see in the future what this leads to.
All right, we'll see what happens. Dr. Jessica Shepard, always great to lean on your expertise.